Hello, Dr. Vikki Petersen here. I wanted to speak with you today about preventing breast cancer as well as reducing the risk of dying of breast cancer for those who have already contracted it. It's not a fun topic, I realize, especially as a woman, and it's one I've kind of shied away from over the years because although I felt there were definitely strategies that could enhance one's immune system, thereby lessening your chances of cancer, there wasn't a lot of strong evidence out there. So in this past year, I have been speaking about it more and more and doing lectures to Silicon Valley corporations. That's where my clinic is. And it's actually really good news, and I do want to share it because it's something that there's quite a bit of confusion about, there's quite a bit of fear about, certainly well warranted, but let's look at some things that we actually appreciate. Now the statistics are that 40,000 women lose their lives to the disease each year. What if you could decrease that in half? Wouldn't that be beyond monumental? Of course, and the statistics are that can be done, but it's not with a miracle drug. It's not with a pill. It's with lifestyle change. And that's something I want to talk with you about, as well as some other strategies we use here at the clinic when we practice root cause medicine. So to prevent breast cancer, there are 5 simple things to do. Now, the first one is manage your weight, which I realize is not necessarily a piece of cake. Sorry, I shouldn't have mentioned cake. Piece of kale. It's not necessarily that easy, but getting your BMI in a good ratio for your height, the size of your bones, etc., is critical. It absolutely is. We know that the more fat a woman's body has on it, the higher her chances of contracting breast cancer along with other cancers. So we'll come back to the weight in a moment, but that's number 1. Number 2 is to eat more plant foods. And then number 3 goes along with that as the opposite corollary, which is to eat less animal products, drink less alcohol, and if you're a woman who's having children, breastfeed those children. It's not only great for the baby, but it's great for you as well. So those are the 5 things that have been stated most emphatically as far as prevention of breast cancer. So where do we fall down the most? And by the way, the point that was given the most stress or the most emphasis regarding importance was to eat more plant foods, because there's so much research supporting the protective effects of plant foods and the deleterious effects of eating animal foods. So that's definitely something you have control over. And interestingly enough, as you eat more plant foods, you will tend to naturally lose weight. Now, what about decreasing your breast cancer risk in half? So that was a number of other studies that came out, and they're similar. The point number 1 was to exercise, and it was just 30 minutes a day, 6 days a week, and it can be brisk walking. It doesn't have to be, taking out a gym membership or anything like that. It was a dietary shift, again, away from the standard American diet and more toward a whole food plant-based diet, which is what we stress here with our patients. So there was just 4 points for the decreasing your breast cancer risk in half. So exercise, once again, shifting to more of a plant-based diet, avoidance of alcohol, and avoidance of tobacco. So a little different, but still on the same thread. And young women who accomplished those 4 tasks decreased their risk in half. Yet older women, so above 40, 45, who accomplished those 4 steps, decreased their risk by 80%. 80%. That's phenomenal. I mean, it's mind-blowing, actually. And these are things you absolutely have control over. They didn't even talk about weight on this one. It was exercise, plant-based, no alcohol, and no tobacco.